Welcome, welcome, welcome. I hope everybody had a great week. Welcome to Thursday Night with Pineapple. I'm your host, Mr. Pineapple himself, aka Terrence Ramses. I am the CIO of the Royal Blossom Company, also the host of Thursday Night with Pineapple, as you can see on the background. Just a little bit about my background, just in case you don't know who I am. I am originally from New Jersey with the West Indian background of the U.S. Virgin Islands and Puerto Rico. And the mission of my brand is to restore, build, and create, to restore all the wealth and resources that have been lost in our communities, to build up the youth and children that are coming behind us, to create a unique commonwealth of like-minded entrepreneurs to put them back in their God-given purpose and talents. And our brand values is to be fun, spirited, and passionate about everything we do. In God, through God, in Christ. That's the whole spiel about the brand. Okay, so we got some great updates, man. It's been hot down here in Tampa, Florida. It's been a lot going on in the fashion industry, and there's some great things. I got some great news about some new promotions that are out. I'm going to go ahead and play the first one about our tank tops. We still taking
Feeling the
pre-orders
heat?
for those.
Why not look just as hot? Fresh, breezy, and built for island life. Our tank tops got you covered, or almost. Grab yours now before they're gone. Limited stock, mad deals. This is your chance to level up your style. Cool looks, hotter prices. Don't wait. Shop now today.
Yeah, man. So once those tank tops get here, you're gonna be excited for them. It's gonna be hot for pretty much the rest of the year. So push the production back because there was a few different productions that we're looking to get simultaneously, all of them at the same time. We're gonna get some new tees, some new tank tops, some new jogger sets, some new hats, some new dresses. So we also preparing for Fashion Week Orlando, and also we preparing for Fashion Week Paris again. There's some things that we had to just adjust. Now that those things are done, all the drought season is over. Now we're moving forward towards everything, man. There's some things that I had to personally take care of last month and recalibrate some things. So I'm excited. So we got some amazing promotions going on. About 25% off on the website. So listen, if you go to the website, you make a purchase of $50 or more. Okay, if you go to the website, we're gonna go ahead and pull up our infamous QR code. Okay, so that's the website, www.royalblossomcommunity.co, or you can scan this QR code. It'll take you right to the website. It'll show you our deals that we have it on at the top of the browser. So any order that's over $50 or more for the month of August, okay, so I'm going to do something real special for you. Anything $50 or more, you get free shipping. Okay, you get your free shipping cost. So it'll be included with your cost, your total cost. So you always encouraging you to make bigger purchases so you don't have to worry about shipping costs. We'll incur the shipping costs. You just get your items and we're going to get it to you within 3 to 5 business days. Pre-orders are coming out as well. As far as the tank tops should be here by September 10th. Also, the red Spanish and the magnetic maroon berry tea should be here by September 22nd. So we're putting actual dates on these. So when you go ahead and press your orders, you'll be able to go ahead and make those purchases. Now with the pre-order items, the free shipping doesn't include it because we're doing it as a pre-order sale. Okay, so without further ado, I want to show you another special promotion we got on. We got our mix and match, any of our dad hats, bucket hats, all of that. 5-400. So we got this. We got the Caribbean based rhythm dad hat, vintage hat. This is one of our most popular ones, including the black one as well. Then we have our deep soul sister right here, which is one a lot of the ladies like to wear. There's also a lighter denim one as well. We have our ocean blue right here. We have our ocean blue. And we got our passion red. You got the Caribbean-based rhythm black. And then you have the green leaf. So I want to also show you a promotional video that we did a couple of years ago. And our guest is in this video as well. So he been supporting the brand for a long time.
You go bow for the result, nothing to discuss, oh. Cause I did win by default and without any doubt, oh. I'm a me happy adult, oh. I no go feed the girl, I no go feed the girl out, oh. I'm a mind that's you the talk, oh. I put my life into my job and I know I'm in trouble. She manipulate my love, oh. I know holy and I know that get both like the Bible.
So we're also going to transition in real quick. We're going to start talking about the private label. Those of you who know, so RBC just recently launched our private label brand called Fashion Law Silk Pay. So we have the ability to private label for big companies and corporations. Just finalized the pricing structure. So I'll go into a deep dive next week about how much everything costs. I'll have a PowerPoint for you as well. So we're still now taking orders for our private label. This is one of the logos right here. Here's the second logo is right here as well. So we'll be able to do all kinds of private label orders for young teens and professionals. Then we have a package for our upcoming designers, and we also have a package for big corporations and big large union entities as well. So we also have individual private label services. I'll go over the pricing structure next week just to double check, have some eyes look over it to make sure everything makes sense. But it's a good pricing structure, especially for the students, and the students are really gonna love this program because it's gonna put them in a position to really start their brand in their teenage years into their early 20s so they can go out here and launch out and build a brand within a year, 2 years, 3 years. They'll be able to build their brands way faster than what we have done over here because the mistakes are going to be discussed. The coaching is going to be there. All the blueprints, all the do's and don'ts, and being able to talk to suppliers, coming up with design concepts, coming up with brand identity, marketing, um, logo creation. We're going to be able to iron out your vision and make it plain, make it your brand purposeful, just like our brands, and it's going to be we're going to make that thing fun. So it's going to also be cost effective. And the ages are gonna be from about like 17 to like 22. So a high school senior, maybe a junior senior to like your senior year into college, and it's gonna put you in a position to go forward and go further faster. So without further ado, so I want to go ahead and start getting into our go ahead and transition this live to our guest. He's been doing some great things in the community over the years. I felt like I needed to bring him on because there's some things that we must discuss about, healthcare and getting people seen, getting people checkups for their dental, getting people seen from also maybe a little bit of mental too, but your physical health. And a lot of times people don't go to like different private practices and because they have incredibly large co-pays or they don't accept their insurance or they just don't have a lot of money or they're underemployed to where they're a part-time employee, they don't have health insurance, so they skip out on going to the doctor, the dentist, and the long-term consequences is they having bad dental health, having bad gum disease, missing teeth, and all that other stuff. So we're gonna get into the nuts and bolts of that. So this guy, he's been in this profession a long time. He's now retired. He's a family man. He's very open-minded, very good guy in the community. He's been respected amongst his peers. He's an amazing father, grandfather, and he does so many things, man. Without further ado, I'm gonna go ahead and bring on Mr. Hal Jackson himself, the legend himself. How you doing today, sir?
I am doing great, Terrence. Thank you very much, and thank you so much for
Yes,
having me on.
sir. So tell everybody a little bit about our backstory and how we met, and a little bit about yourself and your profession.
Well, man, I don't even know how long it's been. I'm going to guess 15 years, Terrence, conservatively. But, when I met this gentleman, just in a quick conversation, he always echoed and embodied the goals in which he shared with us with the opening of the show tonight. and he was a guy that was he's a family man. He's college educated. Uh, he walks. He not only talks the talk, but he walks it as well. Uh, I said I'm talking to a budding entrepreneur who doesn't have any strong interest in working for anybody else but himself, with the goals and objectives to empower and resource our community. And I said, wow, what a great guy, what a great initiative. And I've just been on the sidelines trying to figure out how I can support him over all these years. So I do have a number of the products that I proudly wear. I enjoy wearing them every time I put them on. Have a conversation with somebody as to where it came from, and then I can share the goals and objectives of the brand. It's been exciting. It's been great knowing you, Terrence, and watching you grow and develop as a fine young man and an entrepreneur
Yeah,
as
man,
well.
I greatly appreciate your kind words and us being, being over the years, and me learning about your profession and how we met at 5508, and it's been a great journey so far.
Yes, absolutely,
Very good.
absolutely.
Okay, tell us a little bit about yourself, your background, and what you do for a living, and how you retired and everything.
Okay, all right. So, I feel like I'm living a dream. I'm a third generation Jackson here in Tampa, Florida, Hillsborough County. I proudly share with them that the fourth and fifth generations boots are on the ground in the form of my son and his wife and their three children, which are also my three grandchildren, a 9-year-old boy, a 6-year-old boy, and a 14-month-old girl, our first
Okay.
princess. And so, that's the fifth generation moving forward. Uh, my grandparents on my father's side moved here from South Carolina, uh, raised a family of seven, and sent all of them to college. Didn't think about it. You hear the legacy, but, we had a chance to witness the legacy. Uh, my mother, her roots are in South Carolina, and they met in Orangeburg, South Carolina. My mother was attending Claflin University. My dad was at South Carolina State. That's where they met, and they came back to his home. And so you're looking at one of the twinkles in their eyes, some many decades ago. I have one brother who has passed on. We lost him a year ago, and so I moved forward, and we grew up. We were always a church family, and valued education. Went to local high schools here in Dunbar. Well, I'm gonna go back to the very beginning. Helping Hand Day Nursery, for those who are on the line that recognize that name in the Tampa community. Went on to Dunbar Elementary School, St. Peter Claver Catholic School, Tampa Catholic High School, and then graduated from the University of Tampa. So I've been here all my life. I notched a 33-year career in county government, parks and recreation. And the other unique situation was a result of community service. And I had the opportunity to sit on a board of directors for a group known as Tampa Family Health Centers. In its beginning, it was known as Tampa Community Health Centers. But I was blessed to be able to serve on that board for 27 years. And then when I retired from county government, I came on as an employee and was blessed with the opportunity to work with them for 13. So that total period of time spanned 40 years, exposure to community-based healthcare and working through the challenges of delivering quality healthcare as a member of a team to the Tampa community, but through a larger network known as a federally qualified community health center. And I'll elaborate on that as we
All
go on.
right, sounds good. And what what made you want to get into Tampa Family Health Centers? What was your passion, and what was your vision in getting involved?
it's a great story, a great introduction to a system. First of all, we had three gentlemen that, and it's interesting because we know the names of two of them, and the third person is anonymous. We could over the years we couldn't figure out who the third person is. But these three African American men, one was Robert Cole, another one was Lee Davis here in the Tampa community, another gentleman. They were in East Tampa. They were all businessmen in their own right, and they sat down and said, we want health care for our community. That was the East Tampa, east side of Hillsborough, city of Tampa, north of Ybor City, large African American population at the time. Still pretty predominantly African American now. But their statement was they wanted health care for their community. So they wrote a grant and submitted it to the federal government, and that had to happen somewhere around 1982, because it takes time for an application like that to go through a system. Well, the application was approved, and as a result of that approval, Tampa Community Health Centers opened their first center on a corner of 17th Avenue and 17th Street in just north of Ybor City. A lot of people probably consider that Ybor City today, and that was our humble beginning on that corner. Now, while that was happening, unbeknownst to me, I'm working in county government, and a woman, Ada Bethune, Hillsborough County social worker, saw me one day, and she stopped me, said, Jackson, I got a board I want you to join. And the way we were raised, uh, you know, respecting your elders, my response was, yes, ma'am, and what time and where. Well, that board was the community board of Tampa Family Health Centers. At that point, it was 6 months old, and I joined that board at a very young age, and and that's where it all started, right there. So the first center opened in 1984 on that corner. Probably, let's say 6 months later, probably June of that year, I joined the board and served on that board for 27 years. And so that was my exposure to community-based healthcare, the community-based healthcare delivery system. As a board member, we were a driving force in expansion and listening to the community's needs and translating those needs into services, which today uh, is, at least for Tampa Family Health Centers, 17 community-based health centers throughout Hillsborough County, and there's another health center under the same banner in South County that serves everybody south of Highway 60, and they have 11 locations in South County. And between those two organizations, they're basically 29 locations that folks can access for community health care.
Okay. Let me ask you a few questions. Starting with first, so what?
Sure.
Starting with the first one back in you said 1984, correct? Okay,
Correct.
so
Correct.
starting with that location. So how did they start it off? Did they start it with just uh, uh, like doctors and nurses, and did they have dental, all the ones that you see today?
Great, great question. So the grant was awarded, you know, to the three gentlemen, all right, as the people who submitted the grant. And so what they did was hire a gentleman. His name was Norb Hyde, and he was the first CEO of Tampa Community Health Centers. And his forte was startups. So this was a guy that came in, and he'd gone all over the country doing this. And you give him the grants, you give him the parameters, and you may have land, you may not, you may have a building, you may not. But this was a guy that came in, and he identified all the positions that the grant could support. He found a building. He put together the team that would staff the building. Everything related to HR, everything related to equipment acquisition and putting control numbers and tracking numbers on all of the equipment. That was his expertise, and that's what he had done and completed all of that work um, by the time we opened in 1984. So we opened with one medical director, a CEO, a director of nursing, and a pediatric practitioner in that building on 17th Avenue and 17th Street. And that's how we started. And we just started, you know, promoting who we are, what we're doing in the community, networking, advertising, word of mouth, and that was our humble beginning. That was the first center. You know, 30 some years later, there was 18 of them. You know, through growth, the need of growth, demonstrated growth, our ability to secure other facilities, have the income to hire more practitioners, have them come in and begin to continue to deliver quality health care services to our medically underserved communities here in Hillsborough County.
Gotcha. That's is actually an interesting story behind that. That's I was always curious about that. Why you don't do that in other
Yeah, yeah,
cities, and then you see that is duplicated, and to hear the story that goes behind that is it's actually pretty good. Started off as a predominantly black concept. Now, how
yeah,
did it expand over the years? How did they get more properties, and then how do they still run the vision today?
yeah. So that's a great question. So the organization is actually run, and it's a requirement of the federal government that the board members, that half of the board members be patients of the organization. So we get firsthand input as to what the needs are from the community because we have folks from the community sitting sitting and serving on the board. The community board hires the CEO, and the CEO runs the company. So we look for the CEO to have that business sense, that business acumen to do what CEOs do, and that's lead organizations, track finances, create opportunities for expansion, knowing when the time is right to expand, looking at data across the community, knowing where the greatest need is within a community so that we could expand into that section of the community, be effective in the delivery of healthcare, and then profitable as well.
Who is the CEO now?
So the CEO now is Ms. Sherry Hoback, and she's been at the helm for about 5 years.
Okay,
Great leader. Yeah.
okay, okay. Did you say so? How did they ended up expanding over the years? Like, how did they go from that one location in Ybor City to like all the
Mhm.
locations all over?
Yeah. So again, as I indicated, we've had several CEOs. So as an organization, sometimes when you read about a company uh, and they're changing leadership, and sometimes they'll mention how many CEOs that the company have had. But as I mentioned to you, Noah Hyde was the first gentleman to start out. Um, he served us for the better part of 2 years. That was his forte, was startups. So as he completed that task, he was ready to pass the torch on. So at that time, the board engaged in a nationwide search, identified a gentleman, Mr. Terrence Shirley, who came in. Noteworthy, he was African American, and served us, provided that leadership, uh, expanded to maybe two more sites, three. He served us for 7 years, and then we had a gentleman, and He moved to be closer to his community in Mississippi. His dad, as a matter of fact, was recognized as one of the pioneers in federally qualified community health centers nationwide. So we knew he came from good stock, and he was a good guy that provided great leadership. That wanted to return home to Mississippi and be closer to his family. We launched another search and landed a guy, Mr. Charles Bottoms, who served us for 20 years. And during that time is when we experienced the largest amount of growth here in Hillsborough County. And at the time that he retired, we had 18 active health centers here in Hillsborough County. And his successor was Sherry Hoback, and she's at the reins now. So it'll be a good time to really talk in general terms about federally qualified community health centers. So we're the concept of a federally qualified community health center is a national concept within starting locally. Okay, within Hillsborough County, there's two federally qualified community health centers: Tampa Family Health Centers and Suncoast. And I know you have a broad audience, but for those folks who are Tampa, Hillsborough County based, that's significant information for them. For folks that are outside of Hillsborough County, there are 47 federally qualified community health centers in the state of Florida. And federally qualified community health centers have a presence in every county in the state of Florida. So there's, 68 counties, and each county in Florida has a federally qualified community health center uh, in their community. Nationally, there's uh, there's 1,400 of us. Okay, and so what's significant about that? Federal qualified community health centers charge is to serve the medically underserved in communities across America and Puerto Rico. So we've got federal qualified community health centers in Puerto Rico as well, and so that's their charge. And a part of the founding information says simply that these group of health centers will never turn anyone away for the inability to pay. So that means if a person does not have insurance, that is not a barrier to them coming into a center and receiving quality health care. And so that's a national model that has served this county for 40 years through the two centers that I mentioned, and then nationally moving toward the 60th year of um, of service to the United States, to the citizens of this country. And again, the goal is to provide community-based clinics that provide comprehensive primary care, dental, mental health services to the medically underserved populations. Um, we have a unique status nationally in that we're also designated to be able to provide health care for immigrants who come into the country. So when you read about the immigrations that occur across our borders, once folks land in this country, federally qualified community health centers are positioned to assist them by providing medical care. It's a safety net, and that's how we move forward, and that's how we deliver services across the country. So while we have the places here in Hillsborough County, Tampa, it's a national concept, and you can find a health center through using the Health Resources Services Administration, that's known as HRSA, and they have a tool where you can just put in your zip code anywhere in the country, and it'll show you the closest health center to your community.
Got you, got you. So, do y'all have a mission statement or a core value statement? Where
Well, yeah, I mean, basically, in general, to provide quality healthcare to a very diverse community. And so you can figure that while that's a core value nationally, there's 1,400 health centers whose goal is to provide quality healthcare to the medically underserved across the country.
okay. So let me ask you this. So, what's some of the challenges to being an affordable agency to help the public? What's some of the challenges that you hurdles that you have to overcome?
Yeah, well, great question, and I always look broadly because it's a membership body of 1,400 across the country, and two challenges have emerged, and so if you when I search this in the framework of federally qualified community health centers, the two challenges that emerged was number one, managing technology so that that technology can be efficient and serve the organization well. And I think that's a challenge across many industries. And then the second is maintaining staffing. You know, keeping being able to hire good people to do the job and deliver quality services to the community. May sound it's just two. It sounds pretty challenging, but you know that's uh, that's what it boils down
Got
to.
you. And how is this? How is
Yeah.
this for? I know it's some challenges in doing this for the community. I know that you're doing it for affordable and making sure that the community is served and making sure that their needs are getting met. Now on the physician nurse practitioner side, what would you say the compensation for that? Does the Tampa Family Health Centers compensate their employees and their doctors pretty fairly?
Oh, absolutely, absolutely. That's the success of any organization. You can't nickel and dime yourself in a on an issue that is critical as healthcare. You want to be able to uh, attract the best and the brightest, and you want to compensate them accordingly. So, the bottom line, you're not losing anything, um, but your biggest gain is being fair and competitive within the market, so that you know you can get the best and the brightest. Now, one of the ways that that's achieved is to uh, these federal qualified community health centers have reimbursement opportunities. So, as we attract the best and the brightest, one of the caveats or the carrots is that um, they can secure a contract with us for a couple of years and help pay off their student loans. So we get the best and the brightest. We help them pay off their student loans. We've got the best and the brightest serving the community, and then it's a win-win in that regard.
Got you, got you. So how is it structured? So if I wanted to walk in, what comprises of the Tampa Family Health Center? So is it all in one? So what does it consist of when you walk in? What do you see?
Yeah. So and not just Tampa family, but the experience is just that you just walk in, and a lot of folks when they look at um, the buildings that represent 1,400 federally qualified community health centers. across the country, their response may be initially that, this isn't for me. And that's why we have to all work so hard to get the word out as who we are, what we do, how we serve the community, and in some cases, if necessary, you know, walk them through the doors, so that they can understand that they can get services here uh, with or without insurance.
Got,
And yet, that the patient experience begins right through the front door, and you go from there.
got you. So would you say it's all in one? So they have medical, dental, pharmacy, and all that's there when you walk in.
That's correct. The goal nationwide is to offer a wide range of services that's rooted in preventative care, and that's dental services, mental health services, substance abuse services, health, education, services, and more. We want to be the community's doctor, the source for medical care, the place you think about immediately, soon as you're not feeling well, or even before. And one of the goals of the health centers is to get out on the front with health education. Get to mothers, um, let me put it this way: get to women before they become mothers. Okay, and explain to them, what are the proper steps for starting a family, and once there's a pregnancy, what those next steps are to ensure both the baby's health and the mother's health through this entire process. Uh, in a broader sense, we have family practitioners that see the moms, the dads, the kids, the grandmothers, you know, everybody in the family to provide medical care.
Okay. And y'all take all kinds of insurance.
Yes, they do, nationally and locally. There's a list. Each community has a different list of insurances that they uh, accept. But what's most important is that if the patient has an inability to pay, okay, they can't pay, they can still receive medical services. That's the key statement of federally qualified community health centers.
Gotcha. Gotcha. Now, what would
And that's a hard, I did community relations for many years, and you tell that to people in a group, you tell them one on one, and human nature makes you say, well, what's the catch? You know, okay, I hear what you're saying, but what's the catch? And really, there is no catch. There really is no catch. You know, so part of that experience is that yes, we will ask questions about your income. If you don't have income, you know, we it takes us down another path. But the bottom line, as we get those questions answered, and there's an inability to pay, you still receive services. Now, I'll tell you one. I mentioned the fact that that we provide healthcare services to immigrants. So I've been in a situation where I've talked to people who've been in the country for 5 days, and they were at a center wanting to know how they can get signed up for health care. And it happens, and it works. Another segment of our community is the homeless. Okay, the homeless can walk through our doors and receive that same level of care. And you know, we understand that in some cases there's an inability to pay. And so we're looking at all social economic groups across communities across the country.
got you? Got you. Now, what would you say some disadvantage of getting services at Tampa Family Health Center?
This, Other than, well, so if you talk about challenges, okay, of federally qualified community health centers, and I've done that as well. We've all, I would think that since COVID, um, our community has changed, society has changed forever. And 2021, I think we all saw and experienced things that looked like it was part of a movie before we would actually have to experience it. We went through a period of time where schools were empty, all the kids were being educated from home, air travel was
Yep.
restricted, stadiums, you couldn't go to a stadium to see an athletic event, and it just went on. And we had mass vaccinations going on across the country. We had hospitals filled to the brim with people who were sick and dying at record numbers. And so, if there was something, another element, and I've read articles that said that, you know, just the growing need across the country. And I think we felt a growing need across the country since COVID. A lot of folks lost jobs, a lot of jobs and careers went away. And the workforce did not come back to the level that it was pre COVID. So that means there's more people in need across the entire country. So, as I share, the goal of federal qualified community health centers and their ability to not turn anyone away for the inability to pay, you know, in theory, we could have more people coming to the doors than we could possibly serve. And I'm saying that on a national level, not a local level, but that's a national challenge. There's just a lot of people with a lot of need, but our goal and for what we do is to meet those needs. And so that's how we grew over the years. The need grew. Our leadership determined that, oh, there's a need in this zip code. We see a level of poverty that we could go in and serve, or we see folks from this zip code showing up in another zip code, and we have the opportunity to move into that zip code, and that's what we would do. We'd establish a center, um, establish the staffing of it. We determine how many docs we need, how many nurse practitioners, a pharmacy, dental services, get all that set up because we knew the numbers were growing to the point that it would serve it. So, um, that's a business aspect of federal qualified community health centers, and it's a very, very efficient model across the country.
Got you. What were some of the opportunities and threats of the Family Temple Health Centers?
Can't really, I would think when you look at the growth that that group experienced over, as a matter of fact, my association with them spanned 40 years as I retired in January a year ago. Okay, so that was, let's see, 25, 20, 24. Um, the growth in 40 years of going from 1 to 18 um, just pretty much speaks for itself. You know, the community growth was there, the need was met, and we were doing what we could do.
Got you. Got you. Got you. Question. Another question. What would you say the difference between you and like an urgent care facility?
Okay, good question. Urgent care facilities is another code name for an emergency room. So if you wake up in the middle of the night and you're not feeling well, unless you know that you know what an urgent care is, then you would probably call them and go. If not, you would go to the to the emergency room. As a matter of fact, I'm glad you brought that up because what we found with the populations that we target across the country, that's one of the programs as well. We call it Emergency Department Interdiction Program. In other words, when a sick person shows up to the emergency room, it's going to cost them a lot of time. It's going to cost them money. And even if they can't pay, that hospital bill follows them away from that facility. So a lot of federal qualified community health centers have relationships with hospitals in the community. And when that patient shows up, they don't have any insurance, and it's not an emergency, um, they're redirected. But some emergencies do require hospitalizations, might require surgery. Hospitals will provide that service through Medicaid and other grants that they have. But upon discharge, those hospitals will direct those discharged patients to federal qualified community health centers across the country that they have relationships with. That would happen in Tampa as well, Pinellas, Manatee, and other surrounding counties where they're federally qualified community health centers.
Hmm. Got you. Got you. So how did they transition to getting dental services? What year did that happen?
I don't have the year. You know what? We had, I think we had dental services in the first center, you know. Um, but, we know that that's one of the most expensive services. And so if it's one of the most expensive services, medically disadvantaged and financially disadvantaged folks in the communities, if they can't afford medical care, that dental care is pushed back even further. But we're proud, uh, and all federally qualified community health centers are proud to have dental services available for their community.
Okay. What would you say some of the limitations of Tampa Bay when you're needing going to get seen for like physician periods and dental services? What would you say some of the limitations are?
Just if there's a limitation is tied to the amount of people that are trying to access service at one time. Uh, you know, they eventually get seen. They may not get seen on the schedule that they are hoping for, but they will be seen. Again, the goal is to not turn people away
Gotcha.
and to build that capacity across the community. That's what each federally qualified community health center does uh, in Florida and across the country.
Okay. So what happens if you come into the family Tampa Family Health Center and they're not able to help you with your specific medical need? What's the next plan of action from there?
Um, well, to refer you to someone who can, because we are primary, and health centers do experience situations where folks come to a health center anywhere in the country, and they're too sick. And in some cases, as they walk in, um, there may be a need to call and have them transported to a hospital because they're just that sick. But that just speaks to the ability of the medical staff to determine what they can do, how they can do it, and then respond immediately to the needs.
Okay. And so y'all have like referrals that y'all can send to different specialties and other doctors that will partner with you.
Oh yes, yeah, yeah, definitely.
Got you. And those, and then when you send off the referrals, those are cost effective as well.
Yes, there's a system of specialists that are available to us, and so on that note, let me also make as it relates to Hillsborough County. Hillsborough County is unique in that they have a uh, Hillsborough County Healthcare Plan, which is Hillsborough County's form of expanded Medicaid, and It's funded by a half-cent sales tax. Program is over 30 years old. We participate in it within Hillsborough County. The two federally qualified community health centers, Suncoast and Tampa Family Health Centers, participate in it. And folks are able to draw from that fund and as a way of receiving health care services and support in Hillsborough County specifically. Other counties have variations on it, but we probably have one of the most robust systems here in the state of Florida, if not the Southeast United States, to be able to do that.
Hmm. That's a lot of information. That's a lot of information for the
Yeah,
public.
yeah.
Um, I'm I'm gonna ask you a question. I'm gonna do it. I ask you a unique question. I'm gonna answer it too. But what do you think is fashionable about having this organization?
Well, there's I can go down a different path and approach this from the standpoint of what's known as the goals of, a, of health centers and the goal of this country, but also, you know, um, speak specifically to African American communities across Hillsborough County, across the state of Florida, across the country, and we have um, a significant group of health disparities that we have the highest rates in. So we have highest rates of chronic diseases like higher rates of heart disease, higher rates of stroke, higher rates of diabetes, higher rates of cancer, higher rates of infant mortality, and that's followed up by also higher rates of maternal mortality. So that's one of the goals is to reduce these disparities across communities, to reduce those disparities right here in Hillsborough County, right here in the Tampa Bay area, because people of color, African Americans, Black and Brown, all of those areas that I just shared with you, we share the highest rates of being sick and falling victim to all of those diseases, maternal health, cancer. So how is that addressed? By early detection, early intervention, early medical services, and because we target the medically underserved, the flip side of that is that the medically underserved won't necessarily seek medical services. Why? Because they don't have the money. They may be living in poverty. They're making decisions on rent and groceries rather than doctor's visits. And we break those barriers down. We create that access across the country so that we can have a healthier community.
Gotcha,
That's the goal. Yeah.
gotcha. So I would say how it's fashionable when you have um, an agency like that is just trying to help people and
Yeah.
make sure people is healthy because you having clean insides is gonna have a clean outside. So you come.
Absolutely. It's fashionable because health is wealth. Okay. If you're healthy, you can't you can't say enough about it. But if you're struggling with any number of chronic diseases, you know, people will pay anything to be healthy again. And there we are, we're standing in the gap for those who can't afford it, or at least think that they can't afford it, to be an access point for quality health care across the country.
Gotcha. Yeah. So another thing I would say is, when you look good, got good complexion, got good teeth, got good blood work, all that. That's all fashionable because you be
Hmm.
able to show up differently, show up better.
Absolutely.
Your friends, family show up better for your business and your job. If you work, you just become a better person. Being the best version of you is just being fashionable.
Absolutely. Like I say, health is wealth. You know,
Yep, sounds good. Do you have any closing remarks before we leave?
just that, you know, HRSA, HERSA, for our folks across the country can Google that. Also, you can Google the National Association of Community Health Centers, and both of those websites have Find a Clinic tab where you can just put in your zip code, you can put in your city, your state, and it'll come up with the closest center that's near you. And once you determine that, you know, I encourage folks to walk through that door. Or if you know someone that is in need of health care and they can't walk through that door, that you assist them in walking through that door. Do the search for them. It might be a parent, it might be a grandparent, it might be a sibling that's gotten out of step with society, cousins. It happens. But if they're flirting with poverty, have housing challenges, um, have low income, have no income, Federal Qualified Community Health Center is a destination for them.
Gotcha, gotcha. Okay, that sounds good. And how do they find out about these organizations? How do they reach you if they have any more questions?
Oh, okay, yeah. I'll give you my email address. That'd probably be the easiest way to do it. Everybody is tech savvy these days, so I'll be happy to respond to to an email.
Okay. And
Okay.
what's your email so we can put it in the chat?
All right. H
Mm-hmm.
JACK
Mm-hmm.
JR2 at gmail.com.
All right. You want to reach them, you'll be able to shoot them an email through this right there, and we'll just go from there. So my closing remark is always take care of yourself no matter what the cost is, because not taking care of yourself is a bigger cost. So now that you are aware of this new resource out there, if you need dental, mental, mental, you got physical health there. They'll take good care of you. I personally use it. I use them for dental ongoing. I have a primary physician outside of them, but I use them for the dental coverage. I mean, the dental's pretty good, you in and
Hmm.
out. But it's not bad. You can get all your stuff all in one. So, for example, I had a tooth extraction, and I had
Hmm.
went to the pharmacy. The pharmacy is right there, and the prescription is right there. You pick it up, show them your insurance. You pay whatever. If you ain't got no money, it's like $5-10 to get your insurance. Get your medication. You go get your medication. You just go ahead and do what you got to do. It's pretty. But
That's it. It's real simple. It's efficient. The goal is to be a one-stop shop, and I could have summed it up better
yeah, so
myself.
it's pretty good. But I will say this: the caveat is, each family health center has different personalities, so the staff is a little bit different and unique in each location. So I would say that. But yeah, other than that, they're pretty good and they're pretty good efficient. If you need
Good. Thank you.
you
Thank
need
you.
health care, go check them out. If you have some questions, comments, and concerns, you'll do that. In closing, we're gonna wrap this up. It's been great having you on, Mr. Jackson. We appreciate you.
Thank you so much. I
I,
appreciate it. Appreciate
Oh
your
yeah, I
time.
appreciate you
Thank you
too.
very much.
And you know, as we say, you just don't know what angle we're gonna come from. And next week we're gonna have another phenomenal guest, as always, and we're gonna continue to bring these nuggets and bring these phenomenal people that's in the community, that's across the world, nationwide. And with that being said, we are out of here. Everybody have a great night. I hope that you watch this replay and you get some great information about this and some history lessons in this as well.